It's a multi-part answer. I think we have to be focused on how we diversify our clinical workforce and our research workforce, and also how we take care of patients, women patients, patients from underrepresented racial and ethnic groups, how we best take care of those patients. And so I think those are sort of the two-prong approach to how we improve and move forward our how we do medicine at Duke. And so in terms of increasing the diversity and representation of our clinical and research workforce, we have to be really intentional about that. So it's not something that at the point of, say, residency, you can start to make those changes. The pipeline has to be grown at a very early stage. So it has to be in high school, it has to be in medical school, developing a pipeline of women in underrepresented racial and ethnic groups that are interested in medicine and that are interested in certain subspecialties, that have mentorship at those early periods in time. So I do think the onus is, as a woman cardiologist, I participate in a lot of the professional societies trying to develop mentorship programs and trying to mentor young women who are even at the stage of high school, because those people are really our future. At the DCRI recently, we just completed our first internship program where we recruited all women, underrepresented racial and ethnic group from around the community to come and participate in a 6-month project and internship to look for jobs in clinical research. And those are sort of the intentional projects and initiatives we have to do in order to develop that workforce. And then within treating women within the hospital in clinical areas and in research areas, we have to start developing the research that includes women. So it can't be anymore where we have these large clinical trials that have 10%, 20% women included, but yet we're developing drugs and testing drugs that are predominantly tested in men, but then utilized in women. So we have to be really intentional, I think, about developing our pipeline and about doing good, strong clinical research within and including women and underrepresented groups.